Introduction to IVF. Understanding the process, benefits, and risks. Presentation overview. Definition of IVF. IVF is a type of assisted reproductive technology that involves the fertilization of an egg with sperm outside the body in a laboratory dish. Step-by-step process of IVF. The IVF process involves several steps, including ovarian stimulation, egg retrieval, fertilization, embryo development, and embryo transfer. Preparing for IVF. Couples undergoing IVF need to prepare themselves physically and emotionally. This includes maintaining a healthy lifestyle, managing stress, and understanding the risks and benefits of the procedure. Benefits and risks of IVF. IVF can help couples overcome infertility and achieve their dream of having a child. However, the procedure also carries risks, including multiple pregnancies, ovarian hyperstimulation syndrome, and ectopic pregnancy. Understanding IVF. History of IVF. The history of IVF goes back to the 1970s when the first successful pregnancy was achieved through IVF. Since then, the procedure has become more widely available and has helped millions of couples struggling with infertility. Types of IVF procedures. Different types of IVF procedures include traditional IVF, intracrystoplasmic sperm injection, and pre-implantation genetic testing. These procedures vary in terms of how they are performed and their success rates. Criteria for IVF. Couples who can benefit from IVF include those who have been trying to conceive for a long time, have a low sperm count, have blocked fallopian tubes, or have other fertility issues. IVF may also be an option for same sex couples and single individuals who wish to have children. What is IVF? IVF fertility treatment. IVF is a fertility treatment that helps couples who are unable to conceive naturally. It involves fertilizing an egg with sperm outside of the body, then transferring the embryo to the uterus. IVF success rates. IVF has helped millions of couples around the world to become parents. The success rate of IVF varies depending on various factors such as age, fertility issues, and lifestyle factors. Who can benefit from IVF? Blocked or damaged fallopian tubes. Infertility due to blocked or damaged fallopian tubes can be a reason to opt for IVF. In vitro fertilization, IVF bypasses the fallopian tubes entirely by extracting eggs directly from the ovaries. Low sperm count. Low sperm count in men is a common cause of infertility and can be a reason for opting for IVF. By using intraclytoplasmic sperm injection technique, a single sperm can be injected directly into the egg. Endometriosis. Endometriosis is a condition that affects the uterus and can lead to infertility. IVF can provide an opportunity for couples to become pregnant despite the challenges of endometriosis. Age, lifestyle, and other fertility treatments. Age, lifestyle, and other fertility treatments can also affect the success of IVF. Consulting with a healthcare professional can help couples determine if IVF is the best treatment option for their specific situation. The IVF process, ovarian stimulation. Ovarian stimulation is the first step in the IVF process. It involves taking medications to stimulate the ovaries to produce multiple eggs. Egg retrieval. Egg retrieval is the second step in the IVF process. Eggs are retrieved from the ovaries using a needle guided by ultrasound. Fertilization and embryo culture. Fertilization is the process of combining eggs and sperm in a laboratory dish. Embryo culture involves growing the embryos in the laboratory for several days. Embryo transfer. Embryo transfer is the final step in the IVF process. It involves transferring one or more embryos to the uterus using a catheter. Step-by-step guide to IVF. The IVF process involves multiple steps, starting with medications to stimulate the ovaries to produce multiple eggs, followed by egg retrieval, fertilization in a laboratory dish, culturing for several days, and embryo transfer to the uterus. Preparing for IVF. Medical evaluation. Before undergoing IVF, couples need to undergo several medical evaluations, including blood tests, ultrasounds, and semen analysis to determine if they are suitable candidates for IVF. Counseling and support. Couples considering IVF need to undergo counseling to help them cope with the emotional and mental stress of infertility and to provide them with support to make informed decisions about their treatment. Lifestyle changes. Lifestyle factors such as smoking, alcohol consumption, and weight can affect the success of IVF. Couples are advised to make lifestyle changes to improve their chances of a successful pregnancy. Benefits and risks of IVF. Benefits of IVF. IVF can be a game changer for couples who are struggling with infertility. It has helped millions of people worldwide to conceive and become parents. Risks of IVF. IVF carries certain risks, such as multiple pregnancies, ovarian hyperstimulation syndrome, and ectopic pregnancy. Patients should discuss these risks with their doctors before undergoing IVF treatment. Benefits of IVF. Higher success rates for conception. IVF offers higher success rates for conception compared to other fertility treatments, making it a popular option for couples struggling with infertility. Donor eggs or sperm. IVF provides couples with the option to use donor eggs or sperm, allowing them to conceive even if they have issues with their own reproductive cells. Screening for genetic disorders. IVF allows for the screening of embryos for genetic disorders, reducing the risk of passing on genetic diseases to the offspring. Hope for unsuccessful fertility treatments. IVF provides hope for couples who have been unsuccessful with other fertility treatments, offering an alternative and potentially successful option for conception. Risks of IVF. Multiple pregnancies. IVF increases the chances of multiple pregnancies, which can result in complications and pose risks to the mother and the babies. Ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome is a rare but serious side effect of IVF that can cause swollen and painful ovaries, nausea, and shortness of breath. Ectopic pregnancy. IVF increases the risk of ectopic pregnancy, which occurs when the fertilized egg implants outside the uterus and can be life-threatening. Emotional and financial toll. IVF can be emotionally and financially taxing for couples, and it is important to consider the potential stress and strain of the procedure. Conclusion. IVF is an option for infertile couples. IVF is a medical procedure that can help couples who are struggling with infertility to conceive and become parents. It involves the fertilization of an egg with sperm outside the body and the subsequent implantation of the embryo into the uterus. IVF has its risks and challenges. While IVF has helped millions of people worldwide to become parents, it is not without its risks and challenges. Some of the common risks include multiple pregnancies, ovarian hyperstimulation syndrome, and ectopic pregnancy. Consult with a doctor before deciding on IVF. It is important for couples to learn about IVF and to consult with their doctors before deciding to undergo the procedure. IVF is a complex medical procedure that involves multiple steps, and it is important for couples to understand the risks, challenges, and potential outcomes of the procedure. Thank you.